Good afternoon, everyone. I am a professor of hematology and consultant hematologist in University of Benin Teaching Hospital, where we'll manage patients with sickle cell disorder. And this sickle cell disorder, or some people will say anemia, we will go into the details later. So we are all aware. We just did the World Sickle Cell Day on June 19th, just last month, and the main theme was the importance of effective management of sickle cell disorder. So it's a major public health because we have a real problem with it, and this sickle cell anemia is really rampant in our society. It's a hereditary disorder of hemoglobin characterized by production of defective hemoglobin S. That is it. Then when you now talk about the sickle cell anemia, it is when you now have what we call a homozygosity or homozygous. That is, you have S and S from both parents. You inherit it. It's not the one that is being caused by maybe viruses or bacteria. It's an inheritance from both parents. And that is where we will now come into the sickle cell trait. Both parents have the trait AS. The father has AS, the mother has AS. And when it is like that, the tendency to have the sickle cell, when they take S from the mother, take S from the father, they will now have the homozygosity, which I'm talking about, having the sickle cell anemia. Unlike the sickle cell disorder, which embraces all. When we talk about the sickle cell disorder, we have other types. We have the hemoglobin SC, we have hemoglobin SD, and other ones. The thing is that once you have the S gene in the blood, then it's a sickle cell disorder. But for SS, you are having just S and S together. So like I said, it's a major public health problem because Edo State, where we are in, unfortunately, has the largest incidence in Nigeria, about 2.39. So apart from it being in the country Nigeria being the highest in the whole world, Edo States as well have the highest incidence. And we've been trying to make some awareness program to make sure that this sickle cell can be reduced to a certain level. Now, what are the causes? Like I said, there are no causes. It's an inheritable disorder. So what we see is that the patients, they present in various ways. They can present as in the form of crisis, which we all know. They can present in form of infections, which we will talk about. They can also present in form of complications. Now, when we say crisis, we have four main types. We have the vaso-occlusive crisis, which is the commonest. And that is where we have the painful problems, pain with the sickling, when the red blood cells are sickled, because the normal red blood cell uh, is just what's that word called now? It's just normal. It's not sickled. When you now have it sickled, it blocks all the red blood cells, the arteries, and these arteries usually carry blood to the various organs, the kidney, the spleen, the brain. So once the sickle cells are there, they block all the various arteries, and that is why many of them, they have the vaso-occlusive crisis. They have pains, especially in the lower limbs and all those ones. So it's usually painful because they block most of all these arteries to the various organs, and it's usually the commonest. That's the one we have seen most of the time in our center here. And when you say painful, it's actually, I'm not just saying it for saying sake, because we have seen where the parents, when the child is crying, or the adult is even crying, the parents are also crying. So at times you wonder, who do we now even treat? Because it's extremely painful, since there is blockage of the arteries. So that's the vaso-occlusive crisis. Then the second one is the hyperhemolytic crisis. We call it the hyperhemolytic. Normally, hemolysis is always ongoing in this group of patients, but we call it hyper because the hemolysis is now on the increase. It occurs suddenly and it's on the increase. Hyperhemolytic crisis, destroying the red cells. Then in these ones, the red cells, all the red cells, the reticulocytes are on the increase, because the bone marrow is trying to produce more red cells to try and account for the red cells. So that is what happens in the hyperhemolytic crisis. The laboratory investigations that we usually do is, in fact, it's the sickling test. We start with that sickling test to show that this blood is sickled. And then the other one is what we call the fetal hemoglobin. Now, fetal hemoglobin, there is a drug already called hydroxyurea. Hydroxyurea increases what is called this fetal hemoglobin. Why are there no symptoms in a sickle cell infant? It's because that fetal hemoglobin helps to decrease sickling. So any drug at all that will increase that fetal hemoglobin will be of benefit. So we have this hydroxyurea, which helps to increase the fetal hemoglobin, which helps to decrease the sickling that will occur in each of the patients. There are other drugs, preventive measures, the anti-malaria, which we give them daraprim, paludrin, so that they will not be prone to having malaria, because that's one of the infections that they have. Folic acid to increase their red blood cells, hemoglobin. So those are the other ones that we'll do. Then bone marrow, we just do it to check out the functions of the bone marrow. Remember, the bone marrow is the seat of production of not just the red cell, the white cell, and also the platelets. white cell, of course, for immune fighting the immunity, and then the platelets for bleeding and all those ones. The red cell is also there. So these are the main ones that we do. And then of course the treatment, where we have major problems with some of these our patients. Like I said, this year's theme was the importance of effective management of sickle cell disorder. They just say that once they are okay, there's no need for follow-up, there's no need for checkup. But it is paramount, it's very important that you must do regular checkups, and that is to look at your PCV to see whether is it going down or is it going up. Very, very important. So, but at times many people ask us, what about the bone marrow transplant? Yes, the bone marrow transplant is there. Of course, it will bring a cure, so to say. But these days, the transplant, for example, now cost a huge sum of money, about 8 million in our center here. Now, how many people can afford that amount? So the preventive measures is usually much better, and that was why during this our World Sickle Cell Day this year, we went out to reach the secondary school children, to speak to them, enlighten them about this disease condition. Because once you know about it, then you will now be able to know what to do when it is time to marry, so to say. I mean, as at that young age, as at that secondary school, we want to catch them, enlighten them, let them know about the disease condition early, so that when you finally get married, after the knowing your genotype, when you know about your genotype, you will now be able to take informed decision when the time comes up.
How do you advise general public, people out there, people that want to make the decision considering the fact that they love this person, or these people that also have the diseases, how are they going to manage the disease?
So our youth out there, yes, we know that love and every other thing is there. You can want to marry and every other thing, but all this still depend on both of you taking that, knowing that, like I've just said, they can live long once they do the needful, go for checkups and everything. It's not compulsory that they must die, but you as the parent must be ready to take care of the child, be able to bring the child up, and we have seen that they can even live long. So it's when they're having the complications or infections, are you there? Is it you've taken your decision that is not going to be strenuous for you? So it is you that will still have to take that decision. Yes.
A counselor and a consultant in this field, in hematology, will you advise someone that is having genotype AS to get married to someone that is having genotype AS?
Make your decision yourself. And that is why from the beginning you have to know your genotype, and then you take the decision yourself. You have to take the decision yourself. Are you going to be able to cope with this disorder when you start having your children? So we counsel them in the sense that, see, this is what is going to happen. These are the complications, like all the ones we said. These are what will happen, this and this, So it is left to you and your partner. It's left to you and your partner to make, knowing all the implications.
A consultant in this field want to know whether it is true or when a sickle cell anemia crosses the age of 27 or thereabout, maybe 27 or 30, the person is safe from the disease. How true is this? Do you believe in that saying?
Thank you very much. These are the early stages of growing up, adolescence and all those ones. And as at this stage, you may be prone to all the complications and infections and all those ones, such that, like I said before or some time ago, you will even see some of these patients, you won't even know their patient, sickle cell patient, because they have been able to take care of themselves even right from the beginning. You would not know until they tell you. That's because, like I said, the regular checkups, you must go, even if your PCV is low, is high, is normal, that's the steady state, it's okay. No, you must still go for regular checkups. What was being said before was that they don't live to old age. They don't live like a normal contractor. They don't live to old age. And I want to say, thank God, or well, will I say thank God, or well, we thank the Lord for everything that happens. It's not really like that, because last year, Lagos State, when they were celebrating their own, we had an 80-year-old sickle cell that died. That one survived till 80 years, and I think that's the highest for her. And then coming back to our own Edo State, I will again pay my last respect to one of our colleagues who was a sickle cell, lived up to 62 years. Dr. Naiwu lived up to 62 years. So this was that they don't live long. Many of them still die because of the complications they usually have. It's not a sine qua non that once you cross 27, you will now live for a long time. No, it's not. Because we've seen even normal, ordinary people, they even die at 40, 50. So what would you say about that? So it's not really. Yeah.
Implication.
Okay.
Sickle cell anemia.
Thank you. The society, the social implication for this group of patients is that, if you remember, I told us that when they start having those crises, the parents are psychologically down. Even like I said before, me, for example, because I'm very emotional, I don't even know at times who to treat, because especially for the women, they are down, crying because their children are, so psychologically their morale is down. Then socially, again, how it affects the environment is that if you now have these children, the population of the AS will now be on the increase, and then the chances of having the SS or AS will now be high again. Then you can now talk of even finances, financial aspects. The drugs, the treatments they are being given or taken, they are not at a low cost. They are very expensive. So the parents, or maybe when you are now an adult, Instead of using the money for certain things or other things, you are now being forced to use the money for those kind of treatment. It cuts across. You cannot over. So you must take real I still go back to it. You must be very, very careful. You must be very, very careful, because all these finances, children, every other thing. And then when you even have the SS and then maybe the other ones are AA, that child that is SS, you will have to give, maybe you have to give an extra amount of food to that child compared to the other siblings. So it will weigh much on your finances, your pocket, so to say.
Society today, a lot of persons, they do stigmatize sickle cell patients or sufferers. So as a consultant and a professional in this field, I would like you to advise the public on what we should do to prevent this scourge.
So the issue of stigmatization should not come in at all. We should not stigmatize them. Even in the sickle cell center, what we try to do is to even call them sickle cell challenged persons instead of the sufferers. So ideally, just like HIV, there shouldn't be any form of stigmatization. You can hug them, touch them, nothing at all. They are still the same people like us. So there should be no form of stigmatization on these people. They are not supposed to go through strenuous job description. That's another psychological thing that may to them. Like the tailor now, we tell them that they must look for another kind of job, because when they are in that job, they use their legs, and that is very strenuous on them. Then even some of our other colleagues in the medical field, like the nurses, for example, that's the one I've been involved with. We tell them that maybe if they have to do shift, we tell them that they cannot do a strenuous shift. Rather, they should put them in a place where they don't have to be on night duties. Something really, really not too strenuous for them. Maybe they will now have to, probably like in COPD now, just sit down, and then just as the patients are coming, you just write names, write all those ones. But all those night duties, night days, and all those ones, let me say calls, for example, because calls is very strenuous. That's one thing they don't know. So all those kind of jobs, strenuous jobs, whatever it may be, we tell them that they must change. So those are some of the social and psychological things. They must. Viewers at home, I just want you to watch keenly Environment and You TV show, because it is very informative, it's enlightening, it shows what is happening in the environment that will be of benefit to you.